Assalamualaikum and hello. My name is Muhammad and Muhammad SAIFUL with metric number BM2411053. So today I want to talk about specialty that I have to pursue to my study later. I have choice to be in emergency department, specialist of trauma surgeon. So let's move on to the introduction of emergency department.
So what is emergency department? Emergency department, or also known as ED, is a medical facility that specializing in treating sudden, severe, and life-threatening. If you guys wanna know, there are several cases that always connected to emergency department, such as the most common are car accident, sport injured, and many more. So today, I wanna focus to my favorite part of skeleton, which is humerus. Let's take a look about the anatomy of humerus. So what in your screen? It is anatomical of humerus. The humerus is the long bone in the upper arm that extending from the shoulder until the elbow. Humerus is divided into three main parts, which are proximal end, shaft, and distal end. So guys, the fun fact about humerus is the bigger bone on the upper limb. So let's move on to the biochemical process of humerus. Biochemical process of humerus is divided by three, which are bone composition, bone remodeling, and fractures healing. For bone composition, as we all know that bone tissues is highly vascular and metabolically active, allowing repair and also remodeling. For bone remodeling, it was governed by osteoblasts and osteoclasts. For the fractures healing, it was divided by three phases, which are inflammatory phase, reparative phase, and remodeling phase. So let's focus on fractures healing of biochemical process. For the first phase, which is inflammatory phase, it's also known as initial phase of fractures healing, and the duration is take time about first until the 7 days after the fracture. The fracture will causes the damage to the blood vessels and can lead to the hematoma or blood clotting formation at the fracture site. Inflammatory cells, including macrophage, neutrophils, and monocytes, will infiltrate the area. Move on to the second one, which is reparative phase, or also known as callus formation phase. The duration is start within 1 until 2 weeks and lasts up to several weeks. It is happen when soft callus formation occur first and followed by hard bony callus formation. Reproliferation and differentiation of MCS into osteoblasts and chondrocytes will drive this phase. So let's move on to the last phase, which is remodeling phase or bone maturation phase. It takes a very long duration from months to years. The hard callus is gradually remodeled into mature remnant bone and restoring the bone's original shape and strength. The osteoclasts and osteoblasts will play a central role in bone resorption and deposition. Move on to the disease that related to humerus. I take humerus fractures as a disease that related to humerus. So what is humerus fracture? Humerus fracture is a break in the humerus bone which can occur at the proximal end, shaft, or the distal end. So there are several types of humerus fractures. The first one is proximal humerus fractures that often occur in older adults due to low energy falls or in young people due to high impact of trauma. The second one is humerus shaft fractures. that can result from direct trauma or twisting injuries. The third one is distal humerus fractures. This is quite rare and often caused by high energy trauma like car accident. Let's take a look what is a symptoms if we have humerus fractures. The first one is pain and swelling in the affected arm. The second, inability to move the arm. The third, deformity or shortening of the arm. And the last one is numbness or weakness if the radial nerve is injured, and this is commonly occur on shaft fractures. So this is pictures of humerus fractures. So move to the treatment of humerus fracture. I will take the treatment about surgical only because I wanna be a trauma surgeon one day. So there's our indication for surgery. The first one is open fractures as shown in the picture. And the second is significant displacement or angulation of bone. The third one is neurovascular compromise such as radial nerve palsy. And the last one is failure of non-surgical treatment. This is technology that usually used for treatment of humerus fractures. There are many types of technology, but I only take these two because this is the very common and famous technology for treatment of humerus fractures. The first one is intramedullary nails. So how the provider will use this technology to the patient? The titanium or stainless steel rods will insert into the bone's medullary canal to stabilize the fracture. You can see from the pictures have shown there. So the second technology that we'll use for treatment of humerus fractures, which is plates and screws. It will specialize locking plates and screws and hold the fractured pieces in place. It will promoting the bone healing. That's all for me. Thank you.